I'm Dr. Sophia Yen, and this is Q&A with Dr. Y. You might have heard about Plan B, the morning after pill, emergency contraception. Let's talk about that today. Why would you need emergency contraception? If you have a contraceptive accident, that's when you need emergency contraception. For example, if you miss 3 days of your birth control pill patch ring, you need emergency contraception. If you're late for your Depo-Provera shot, you need emergency contraception. And if, God forbid, you were sexually assaulted, you need emergency contraception. What are the methods of emergency contraception? There are 4 methods of emergency contraception. The most effective method of emergency contraception is the copper IUD. You need a doctor or a nurse to stick this in, and it can also work as birth control for the next 10 years after having a copper IUD placed. However, if you're not into having a procedure, you can get the second most effective form of emergency contraception, and that is known as Ulipristal acetate, or ELA. You need a prescription for this, so ask your doctor or use our telemedicine service. And if you have insurance, under the Affordable Care Act, this method should be covered, and therefore it would be free. Ulipristal acetate works better at every single time point compared to its over-the-counter competitor, which we'll talk about next. It also works better for women who weigh 160 pounds or more, or who have a BMI of 26 or greater. This is the #1 method that I would prescribe to and suggest all women consider if you're not into the copper IUD. The third most effective form of emergency contraception is known as Plan B, or the morning after pill, or Levonorgestrel. If you go into the pharmacy, my tip to you is don't ask for Plan B, but ask for generic Plan B. Because if you ask for Plan B, that's $60. If you ask for generic Plan B, that's $20 to $40. And if you get this ahead of time, which we recommend getting emergency contraception ahead of time, then you can deal with it if the insurance doesn't have the generic, if the pharmacy doesn't have it in place, and they can order it for you, and you don't have to pay the $60 name brand price. The least effective form of emergency contraception is you take 4 birth control pills now and 4 birth control pills later. But it depends which birth control you're on, because some of them you might have to take 5 or 6 pills, so you have to look it up on the internet. But if you're stuck in the middle of nowhere and all you have is a pack of pills, this is an option. But it has half the efficacy and twice the side effects of all the other methods. So use the other methods first. And I want you to think about emergency contraception like a fire extinguisher. Don't get it when you have the emergency, but have it just sitting in the corner, and it may expire in 2 years, but if you have that emergency, it's ready to go. I tell my patients, if the condom pops at 3 a.m., I want the medicine in that young woman's mouth at 3:10. I don't want any cuddling, snuggling, waiting till the morning after. I want 3:10 in her mouth if you want to prevent unplanned pregnancies. Thank you for watching Pandia Q&A with Dr. Y. If you have any questions, definitely ping us on Facebook. And if you're ready to skip the trip to the pharmacy every single month, go to pandiahealth.com and sign up. Tell your friends.